I'm talking with Dr. Richard Rosenfield, Medical Director of Pearl Women's Center, about a problem that affects 1 in 2 women, urinary incontinence. Dr. Rosenfield, why is this such a common problem in women?
Well, urinary incontinence or leakage of urine is a very common problem in women, oftentimes related to the trauma of either carrying a baby or childbirth.
I really feel like a lot of women don't want to talk about this amongst themselves. There's this sort of embarrassment, not to mention fear, of having incontinence.
Well, let's face it, talking about urinary incontinence is not typical water cooler conversation at the office. The reality is many women are faced with this type of problem where they're leaking urine, and as a result of that, they're not jumping on the trampoline with their kids, they're not swinging a golf club, they're not able to go to the gym anymore, they're altering their lifestyle because of this. And if things like physical therapy and basic exercises are not correcting the problem, then there are some really easy outpatient procedures that have an incredibly high success rate. Within a couple of weeks, they're back to picking up their grandkids, they're going to the gym, they're running on the treadmill, they're playing golf, and they're not worried about having to run to the bathroom. And so these are tremendous things for our patients to be able to get them back to the lifestyle that they want and need and they're used to.
So are we talking major surgery?
Not at all. As a matter of fact, the newest procedures that are available for stress incontinence have a tremendous success rate, and they're performed in about 20 minutes in an outpatient setting, very little discomfort, fast recovery back to work, and the success rates are astoundingly high. I do think it's really important for women to get informed and potentially get on the internet and do some research and figure out what their options are. And in surgery, in today's modern world, there are so many options out there for patients that are well informed, especially when looking at lesser invasive approaches to surgery. I think the most important thing about treating incontinence is making certain that you go see a physician that has experience in diagnosing and treating the problem. Many of these problems can be fixed with non-surgical approaches. However, in many women, surgery is required, and the important thing for our patients to know is that these surgeries do not require a hospitalization, and they're not painful. They can be done quickly with a very fast recovery.